We have a guest with us today, Rob McCann, who's the Executive Director of Catholic Charities in Spokane, and he will be the gentleman that will hopefully, be asking to come down and speak to our group on March 19th. So we'll just start with Becky and go around the room, and if everybody would say their name and who they're with, that would be awesome.
On the Hammer with Kenote Housing Authority.
Ruben Peralta, Community and Tribal Engagement Specialist for Greater Columbia.
Diane Halo, Greater Columbia ACH. Carol Moser, Greater Columbia ACH. Lauren Johnson, Greater Columbia ACH. Sam Riddell, Greater Columbia ACH.
Wes Lucky, Greater Columbia.
Melissa Hess, CAC. Diana Young, CAC. And on the phone, Kurt?
That's Rob McCann from Catholic Charities in Spokane.
And
Mark
Kirk Williamson, Ben Franklin Community Health Alliance.
Thank you, Kirk.
Mark Walker with Providence St. Joe Health.
Hi, Mark.
Hi.
Hi, this is Deborah Reed with Lords.
This is Kyle Sullivan with Human Services.
Do we have anybody else that's on the phone? Well, thanks again for everybody attending this meeting. We're anxious to hear from Rob McCann. So Rob McCann has, every time I talk about housing for supportive housing, Rob McCann's name comes up. So I think, Rob, you have a personal friendship with Rob Wadlow, who is the CEO for St. Mary's Providence in Walla Walla. But I know Becky Gross has also brought your name up in other venues that we've heard about your name. So your reputation precedes you in helping communities build successful housing projects. So we're very anxious to kind of hear, what the backdrop of that is, and maybe a little bit about your experience in Spokane, and hopefully you can help us out on March 19th when we're having this housing summit. So if you wouldn't mind just talking a little bit about your housing adventures, we'd love to hear them.
Yeah, happy to. Thanks for having me on the call. I'll start by telling you that this issue is pretty controversial, unfortunately, when it comes to homelessness, because no matter what you do, someone's going to get angry at you. And so that's the first thing I'd probably share with you. Can everyone hear me okay? I should probably check.
Yes, thank you.
Okay.
I hear you, Rob. Thank you.
Okay, good. The other piece is that, in Spokane anyway, what we've done for the last 6 or 7 years is our goal was to build an apartment for every chronically homeless man and woman in Spokane. We've made some good headway towards that. We've built and opened probably 6 projects in the last 6 years. And with that, we have a big homeless shelter, House of Charity in Spokane. And for us, the reality is that most of our chronically homeless are dual diagnosed, so they have mental illness and substance abuse issues going on at the same time. And they're very expensive super utilizers. So for us in Spokane, and I don't know if this is true down there, you guys would know better than me, but in Spokane anyway, the average homeless super utilizer can spend, I don't know, anywhere from $50,000 to $250,000 per year per person on police, fire, ER, hospital, jail, social service costs, etc. Or for about $8,100 a year, we can put them in one of our apartments. They are housing first apartments, which means that people are actively using or actively off their meds in these apartments, but it's a better deal in terms of cost aversion. It's better for the hospital systems. It's better for the local taxpayers. But like I said, this does not come without controversy. We've built several hundred units in Spokane. And when we started, it was kind of like, hey, this is great, good for you. And now we're 6 years into it, and we're already starting to get people saying, hey, wait a minute, the food is so good at House of Charity, or the word is out about these apartments, you're attracting the homeless people from all over the place. And that's the first problem you run into. The second problem you run into is people who are going to tell you, hey, you're enabling these folks. They're out there using and drinking, and you're giving them 3 hots and a cot. There's no path for them to get out of their addiction. And so I can share with you answers to all of those questions, but those are the big kind of controversial issues as homelessness becomes more politicized, and it is becoming more politicized. People are taking sides. The days where, and I've been at Catholic Charities for 19 years, the days where people just say, hey, Catholic Charities, gosh, God bless you, guys are doing great stuff. And that was really all you ever heard. In the last 3 years, that's changed. People now are saying, hey, wait, you might be part of the problem. And there's a huge group of people in Spokane, and probably down where you are too, that honestly believe if we just would close the shelter and stop building these apartments, all these people would magically go away, disappear. Now, we know that common sense and science tells us otherwise, but there are people that believe that, and they have powerful voices, especially business owners and people like that want to see the economy thrive. They see homelessness as a threat to that. What we see is people that once you get them into housing, they have dramatic transformations. They don't all necessarily stop using. Some will die from their addiction. They don't all necessarily go back on their meds. Some do, some don't. But there's a better human dignity for those people. There's huge cost aversion for your local healthcare systems and your local police, fire, and jail, and your local taxpayers. And it's a better quality of life for people who do want to go shop at the Apple Store or go to a restaurant or see a movie downtown. Because there aren't 400 of my folks out there panhandling or shooting up in the women's shoe department at Nordstrom's. So, we've built all these units. We use tax credits to build them. So they're these 50-unit buildings. They run about $11 million a pop. I don't have to raise a single dollar from a single private donor to build them. They all come through 9% tax credit deals. The IRS pays for all of it. In fact, we're just at the beginning of looking at maybe doing one in Pasco. We've started a market study and looked at some sites and the very beginning conversations only. But the bigger issue really about homelessness is, these super utilizing folks that are very ill and on the streets and causing a lot of pain to themselves, but also costing a lot of money. We had a guy that went to the ER 62 times in 1 year. That's 62 police trucks that roll, fire trucks, cop car and ambulance, 62 ER visits, 62 hospitalizations. We put him in Father Bachhaven. The next year he went twice. And it's not just the hospital that likes that. It's police, fire, ambulance, it's everybody. And most importantly, that guy, who wants to go to the ER 62 times in a year? Nobody. And so it's a win-win from a finance, from a math perspective. It's a win from a human dignity perspective, but it is not without controversy. Catholic Charities is in the newspaper all the time. And sometimes it's people taking shots at us because they think we're doing it wrong. So the good news is these are solvable problems. These are buildable buildings. If you want to build buildings like these, it's doable. And they are manageable. We manage all these properties, and yeah, we have our moments, but for the most part, they run pretty well, surprisingly so. And the shelter, although it's a very intense place, it tends to hum along fairly nicely, but that doesn't mean everyone likes it. That doesn't mean people still don't believe, hey, I wish you just closed that shelter, all these people would go away. They thought the same thing in Seattle 15 years ago, and now they've got 4,000 homeless people sleeping in tents on the sidewalks in downtown Seattle. So I'll stop talking because otherwise I'll go forever and people can ask questions.
Hey, Rob. It's Mark.
Hey, Mark.
Could maybe share a little bit about the reason why your approach is so successful versus just building a dwelling? It's the additional services to provide the support to your residents. Maybe elaborate on that a little bit based on our discussion a 3 weeks ago.
Yeah, that's probably the biggest part of this is, you can get the bricks and mortar money from the IRS, and we do that. But once you put 50 chronically mentally ill, chronically substance abusing, chronically homeless individuals in a building, if you don't have some services, then you're going to have the Wild West pretty quick. So what we do is when we build these buildings, we build a suite of about 15 offices on the ground floor, and we give them out to anyone who wants them. Mental health providers, substance abuse providers, community health workers, doctors, nurses, our own counseling program, people go in there, our own case managers go in there. We surround these 50 people with a lot of services and a lot of people and a lot of precious presence so that when they go off the rails, we stop them from getting evicted. And if you can intervene in something in the first hour, then it doesn't become a 911 call, an arrest, and an eviction. So we put lots of people in the building, lots of staff, lots of the 15 other cafeterias programs, senior services, counseling, immigration, emergency services, case management. They're all in these buildings. And you just bring a lot of people and surround these 50 people with the goal of, we want them to maintain their stable housing after 1 year, 2 years, 3 years, 4 years. And, that has seemed to work. We bring in a lot of people. Even lately now, we've brought in the real big guns. We've brought in the retired nuns. So we've got these 80-year-old nuns that come to these buildings, and all they do is bake chocolate chip cookies, and they go door to door, and they go knock, knock, knock. Hey, you want a cookie? And who the hell's going to say no to a nun with a cookie? Nobody. But what Sister Mirta is really doing when she knocks on that door, what she's really doing is she's looking in and saying to Bill in Unit 202, "Hey, Bill, how you doing?" And she's checking him out. Has he bathed lately? Is he changing his clothes? Does he have 5 people living in there? Does he have an apartment full of stolen bike parts? Is he hoarding? What's going on? And if he's off the rails, she walks downstairs and tells one of the staff, and they go check on Bill. And then that way, Bill is able to, stay in stable housing. One of the stories I always tell people, we have a guy living in one of our units that he could be in the room with all of you, and you would probably not even know that he's been pretty substantially mentally ill and on the street. He's articulate. He's well kept. He doesn't drink or do drugs. He's just got mental illness. And if you go to his apartment, every single inch of his apartment is covered floor to ceiling with tinfoil, because he believes the government's listening to his thoughts whenever he sleeps. And if the tinfoil is up, he's fine. If the tinfoil comes down, you've got about 2 hours before the police are going to be there. And so what do? It's crazy, but we give him tinfoil. We give him lots of tinfoil. We duct tape tinfoil behind the laundry machine where only he knows it's there. So if it's 4 a.m. and he needs tinfoil, he goes and gets it. He's been in there for 6 years now in his apartment, and he's been doing great. That's the level of mental illness we're dealing with. So that's the level of staff you need in these buildings. You need the precious presence. And I call it that for a reason, because when I talk to residents who've been there for years and have gotten out of homelessness, and I say, hey, what was the biggest thing that changed your life? What their answer is will surprise you. It's not, hey, I finally have my own bed, I have my own kitchen, I have my own bathroom, I'm safe. It's none of those things. What they all say for the most part is, the biggest thing is that every single day, someone, and usually the same someone's, asks me, hey, how you doing? And they know my name. And they stand around and wait for me to respond. And these are folks who say, I've never had that in my life since I was 4 years old, where someone said, how are you doing every day, and stood there and waited for you to give an answer. And that precious presence is what stabilizes people, in my opinion. And so we load these buildings full of staff. Most other organizations building these buildings, they'll have a property manager and a maintenance person, and that's probably about it. We'll have that plus another 10 staff at any given time. And so you're basically saying, I'm going to make sure these 50 people never get evicted, never go to jail, and never go back to the shelter. And if we can do that, that's 50 people times a potential $200,000 a year per person in super utilizing fees in the community, and 50 more people I'm taking out of my house charity shelter, opening up 50 more beds there. And started with a building called Father Bach Haven back in 2012, 50-unit apartment complex next door. Now building Father Bach Haven 8 and 9. As I'm on this call, the construction sites are going. They'll be open at the end of this year. And so we've taken a solid 32 to 33% of the chronic street homeless population off the streets of Spokane and put them in housing. Have we ended homelessness? No. We're never going to end homelessness. As we're having this phone call, someone is becoming newly homeless. Someone is being evicted. Someone getting out of jail with no place to go. Someone has finally run the gambit of all their couch surfings and they've been kicked out. They're becoming homeless. We're not going to ever end that. But we can solve homelessness in Spokane. And solving it means every human person should be eating and sleeping and going to the bathroom indoors. And while they're in a shelter and indoors, they should have a path to an apartment, to housing. And when we've been able to do that in Spokane, at least 24/7 sheltering at House Charity, the city pulled the plug on that funding. So currently we don't. But it proves that you can solve it. And these buildings are buildable. The money's out there. These tax credits are mostly underutilized in a lot of parts of the country. And right now, if you want to build homeless housing, it's unlikely that you put an application in that didn't get accepted. And these buildings, keep in mind, are anywhere from 10 to 12 million bucks a pop. And you get every penny of it. And then after 16 years, you own the building free and clear. You don't have to pay back anyone anything. And that's how we've built all of these now for many, many years.
Rob, this is Kyle Sullivan with Human Services. How is it that all the additional services that you guys provide there, what's the sustainability? How is that funded?
That's a great question because there is no funding for that. And so what we do is we go to other organizations like Frontier Behavioral Health or
Rob?
Uh-oh, yeah.
Rob? Way to go, Kyle. Offended you.
Yeah, geez, that's what I get for asking a question. I ask one question and the guy hangs up on it.
Well, I know that he was on the road when he was calling us, so maybe he went through a dead zone. How is this sounding so far, you guys?
Sign us up.
That's great.
Sounds amazing.
I know.
Sustain the building after the children.
Yeah, we need to ask that question. Yeah, he does say that.
I'm sort of wondering about
Just an FYI, when we build tax credits, and we've done 2 projects since 2014, we used to sustain that. We had project-based vouchers for a portion of the units, which helps with overall sustainability. And we look at a 30-year performance. And the tax credits, really, you have to show that you can, that you'll pencil out and cover the debt service. All that required. So project-based vouchers are a big deal.
So what is a project-based voucher?
It's like you get, housing authorities get an allocation of vouchers.
Okay.
A portion of those, up to 20%, can be project-based in a project. And we project-based, for instance, 20 units in Nueva Vista 1. We project-based 14 units in Nueva Vista 2, which enhanced the overall sustainability. It also allowed us to have a service coordinator on site, and hopefully soon we'll have a contract with CAC to do some of their services. And we built a room to teach in, a teaching room. We have a computer lab for folks. We have a small meeting room there in the first phase, and a large meeting room for classes and task pressures set up for classes. In the second, where we could teach ready to rent. We have a service coordinator on site, half days, who is there and helps them. We also can start an escrow account and be on a family self-sufficiency program. So as they gain income, a portion of that extra, they pay more rent. A portion of that rent goes into escrow. They get head start baseline, and then they could save money for school, to start a business, buy a house. We have one person who's been on that program for 2 years, came into the program homeless. They had taken their children away, first step to getting children back to get housing. And she did that, then she got her children back. Well, then she got a job because she had housing, she got her children back. And now she's looking at buying a home. With her voucher, she can take that. We have a home ownership program. The CAC helps us with down payment assistance, and as well as the Tri-Cities Home Consortium, and she's house shopping. So she's going to be a homeowner within just over 3 years, from homelessness and no children to some of this viable.
By the way, this is Betsy Metcalf.
Usually that's science stuff that
So is Rob back on the line? Go ahead.
Hey, well, I have a quick question. This is Kyle again, and maybe Lona, you might be the one to answer this, because although I have very basic understanding of the requirements for the tax credit, but I think the question I would have is I think that the individuals that are able to, I think we're talking about two different sets of clientele, and correct me if I'm wrong, but it sounds like the individuals that that Rob is talking about are the individuals that we have, say, for example, are participants in the hotspotters. And so I think, I don't know, these are the individuals that again, kind of like what Rob described, are the super users of all of these services. And I don't know how I think, Lona, the people that maybe are awaiting, maybe a Section 8 voucher or a project-based voucher, or those might be a different set of individuals. I don't know if some of the people that I'm thinking of have really the ability to navigate that system. Maybe I'm wrong, but how any thoughts on how we're, if we're looking at these super users, what's the reality of them falling in line with the requirements that it would take to get any type of a voucher through one of the housing authorities? And again, maybe that would all fall in line and it would work great. But in the event that it didn't, what's the avenue for there? Because and again, hopefully Rob can come back on, because I'm curious as to how many of those individuals have some type of a voucher attached to them through a housing authority, versus someone who is really unable to get to that point. Any thoughts from anyone?
I think you're correct. I think the super users, those really truly housing first projects, and Alaska had one that was done by the Community Action Agency called RealCap, and they bought a 57-unit hotel, and they really worked really hard with those folks. They did not have vouchers. They had state and federal funding in that, but they really had a lot of case management backing them up, because they can't function if you've got a chronic alcoholic coming on that's an end stage. And their goal was to house people and to allow them to die with dignity in the cases where their dysfunction was so bad that they were going to die from cirrhosis. And it's totally different than the newly homeless coming in, mom with children that I was talking about a minute ago. And the folks we serve, the Wave of Us are two, are based on homeless families with children that have had a bad accident or something that threw them into homelessness, and they get on steps. I think what he was talking about is that level of care with that roundabout 24/7 care that sometimes you see mental health centers doing. In Alaska, the mental health center took that group on specifically with the.
Hey, sorry, this is Rob. I don't know how long I was gone.
You were just talking about Frontier Services coming in for sustainability when there was no funding.
Yeah, then that's how we do these buildings. Is to invite other providers to come in and provide services.
Kyle, does that answer your question?
Yeah, I would imagine, just in kind of my thinking, a lot of these super users are active in with, and again, I keep going back to the individuals that we have in our hotspotter program, and I sit there and I think, well, most of those people are have Medicaid or are Medicaid eligible, and so they're enrolled in services, and so there would be the payment aspect of that for the provider, that's providing specific services there. So I think that answers my question. Yeah.
And we are looking at, I don't know if you heard this part, or I was talking to nobody for a long time, but we are using the Medicaid waiver to try and get some more money for services.
Excellent.
Okay, great.
In fact, I've been trying to tap into who is doing Initiative 2 here locally. I don't know who that is, but
it's Better Health Together up here.
Okay. Is it you guys, the CAC, doing Initiative 2 on the housing?
They haven't started it yet, but we're hoping that they do soon at Better Health Together, which is who's doing our waiver up here.
Okay. All right. What is waiver 2? What is that? Well, so there's 3 initiatives to the Medicaid waiver. There's the ACHs, and then there's supportive housing, and then there's and supportive employment and the long-term social support. Actually, I think it's initiative 3 is housing and supportive employment.
Foundational housing and employment, right?
Yeah.
And the Merit Group, I think, is the organization that's contracting with the MCO to manage that initiative.
Right, but the MCOs have expressed an interest in housing with the ACHs, so there could be some additional funding that's set aside for that. So what do you think our strategy should be, Rob, so I am armed, I have this army of people in this room and on the phone that I think are very interested in helping our community get some more supportive housing, especially for those high-risk individuals. What advice can you give us as we're moving this strategy forward, and who should we have at this first meeting where we are going to be discussing this whole concept?
Well, that's a good question. I've been talking with Dr. Nevin for years about this in Pasco, and in my mind, the first thing you need is a good homeless shelter that takes anybody in any condition, and that's hard to find in a lot of communities. But you need some level of that in order to kind of stabilize people and get them ready for housing. The second thing you need is someone willing to build a tax credit project or 2 or 9 for you down there. And those are both doable things, but they come with a lot of lightning rods in there. And but you have to have some kind of shelter system, even if it's one shelter, and you have to have a nonprofit willing to partner with you on building these 9% deals. Your local housing authority could build them. Any nonprofit can build them if they've got experience. The city could build it technically if they really wanted to. So then the big thing is you got to find dirt that's zoned correctly, where you're not instantly going to get sued by 3 neighbors.
You said that Catholic Charities is doing a market study in Pasco. So are you saying that Catholic Charities might be willing to build a project in Pasco if we can get enough community support behind it?
Yeah, we've actually just completed the market study. So we took the last 6 months and did a market study for a 50-unit chronically homeless housing project in Pasco using a piece of dirt that we already own across the street from the hospital as the market study model. You have to do a market study as a first step to do a tax credit project. You have to hire an outside firm that comes in and says, yes, this is viable in this community. There are enough homeless people where you can fill a 50-unit building. We've done that. I paid for that 6 months ago. We got it done, and I think I sent it to some of you in the room, so you should have copies of it.
Alyssa's shaking her head. She must have gotten it.
Basically, the market study said, yeah, absolutely, which is no surprise. I knew it would say that. But that's the first step in a tax credit project, and we've already got it done. So then the next thing is you need land, and we have a piece, although I'm not sure it's ideal. Maybe it is, maybe it's not. There's probably better land in Pasco. We've got a couple projects in Pasco already. Bishop Topol Haven is our project. Tepeyac Haven is our project. Those are for farm workers, but we've built down there before, and we would be happy to look at building down there again for a homeless project if that's something the community wants. But you also need to have some kind of shelter component in place down there, and I'm not sure what shelter ability there is down there. I know there's a UGM, but if you got to be clean and sober to get in, that's great. But when we finally get people clean and sober, the last place I want them is in the House of Charity. Trust me, we send them to the UGM. Thank God they're there. But if that's the only show in town, most of the folks that you want to put in that housing because they're super utilizers, they're not going to blow that breathalyzer and get into UGM. So you need some kind of shelter where they can get in and get the dignity of a bed and a meal and a shower and a bathroom, even while they're still using.
So is your housing then, it's not wet housing then?
Oh, it's soaking wet. We have most of our residents are actively using, but we slowly work with them to reduce that on themselves. But we don't make that a condition. But if you'd asked me 19 years ago when I started, hey, would you give an apartment to a homeless person that's not clean and sober? I would have told you absolutely not. We never do that at Catholic Charities. And now, 19 years later, I'll tell you it's the only way to do it. So we have people who are actively using meth, heroin, you name it, in their units. And as long as they manage their addiction to where they're not disturbing the community or creating any kind of major issue, we work with them. And that'll get you in trouble with a lot of people in your community. Trust me.
So we have our permanent supportive housing programs, which are leasing dollars for chronically homeless individuals. So same population that we're talking about serving. But we, aside from our statement building, the rest of the vouchers or the leasing units are housing experience the same things, that you meet people where they are, offer them the services, they're housed, and they may still actively be in addiction or not taking their meds, but they're housed. Right. And so to us, that's progress, and that's one of the HUD holds us to. So our housing stability outcome. And
we've intentionally avoided calling it wet housing because it scares too many people. The truth is, all of your housing in Pasco, as you sit there right now, is wet housing. You know, no one's stopping anyone from drinking in their apartments in Pasco. So this place you're building, or you may want to build, it's wet housing too, but we don't even call it that anymore because it freaks people out. It's just supportive, permanent housing. And yeah, just like any other apartment in Spokane, if someone wants to move in and drink or drug, they can do that. And as long as they keep to themselves behind closed doors and don't make a ruckus, they'd probably get away with it until they're overdosed or dead. But, you know, we have services on site, so some people get services, some people don't. We've had plenty of people die in our apartments because of their addiction.
Well, I think we would love to have this summit. I think part of the reason that we would have this is just to show the community support behind such a project. So that I know we're going to receive opposition. I'm not naive, and the not in my backyards are going to come out. I would think. I'm sure, Lona, you've experienced that. You've probably experienced that, Dan. You've probably experienced that at CAC, right? That this is a population that matches a true need that we have in our community, because we have some of the highest emergency department utilization rates in the state of Washington. And we have a high opioid utilization rate. And interestingly enough, we don't have higher than the state average of homelessness here. So I don't know where you got your data from, Rob, that at least the point in time count didn't show that we were, you know, any higher than the state rate. I don't know if that changed this last go around, Kyle, since we just did it.
Yeah, we won't have data for a while yet.
Okay.
You know, that said, though, these super utilizers do pull out a lot of utilization and a lot of concomitant dollars from the system. And something that all of us in the ACH have realized is that if you have somebody who's persistently mentally ill or opioid using or substance using, if they're homeless, you cannot treat those disorders. You cannot treat those disorders. Maslow hierarchy pertains here. They have to have their basic survival needs taken care of first before these other needs. So ignoring that just perpetuates the problem.
Well, are we all in agreement that we should have this housing summit on the 14th or the 19th of March? You guys available to come and listen? I did talk to Rhonda Huff, who has done some housing shelters in Yakima, and she's willing to come down and talk a little bit about some of their success stories too, about housing first. And she's been on the national circuit, our board president, but she has a lot of experience in this area. And so I think, Rob, it'd be great if you could come down on the 19th of March and we can have more of a community discussion around this. Interestingly enough, on Tuesday, a group of the GCACH staff attended a commissioner meeting around the syringe exchange program. And we actually have one of the commissioners that's going to come and talk to us tomorrow. I think he was very interested in some of the testimony that we provided and wants to learn more. So I'm hoping that we can open people's minds up about this whole situation of housing first and addiction and or substance use disorders, and you know, and try to explain that this is a national strategy that until you get people housed, it's really difficult for them to address all the other issues in their lives. We just have to change people's attitudes. So I
terms of their lease and living in their unit, they're entitled to be housed. And that way you avoid that wetter down discussion, where you really talk about behaviors, and if they have a behavior, they're smoking crack out in front of their car with a bunch of children that are running about, then you deal with the behavior. But if they're in their house, you're not necessarily going to know about it. And we do go by that at the housing authority. We're not wet, dry, damp. But if you have poor behaviors that are impacting your neighbors, then you will get affected. I think that's a great way to focus folks away from that damp, that non-issue, as far as I'm concerned, the damp or wet.
Did any of you have any questions, Rob?
Yeah, this
So,
is Kurt.
Rob, this is your neighbor just across the railroad tracks, Patrick Jones.
Oh, hi.
I think it'd be helpful, and I know this is maybe not an issue that you have all the answers to, but it would be helpful to have a discussion, and perhaps you talk to that point of how one can and should answer the concerns of the business community, because it will come up anywhere.
Hey guys, this is Rob. Sorry to interrupt. I got kicked off again, so I lost you. But before I get kicked off again, I'll let you know I can come down that date. It's on my calendar.
Okay. So we have a quick question for you, Rob, which is, how do you answer the concerns from the business community about supportive housing?
Well, there are plenty. The way you answer it, the best way to answer is with math, because math is not Republican or Democrat. 2 + 2 is 4 no matter what. And the amount of money that you can save for the whole taxpaying community is immense when you do these projects. But also it helps with economic development and vitality and retail and hotels and restaurants and all those business owners that, do you want these folks in apartments and in a shelter, or do you want them in the women's shoot apartment at Nordstrom's? Where do you want these folks, on your loading docks or in your alleys or hanging out panhandling in front of your restaurants, or do you want them housed and sheltered? And that argument works with some business owners, although none of them want this stuff anywhere near them. Someone's going to have it near them. So those people are almost always never going to be happy. But the general business community, there's lots of studies that show how much money can be saved on utilization aversion, and how much money can be saved on basically the reduction of quality of life crimes in your downtown area, and how that sparks all kinds of retail and economic development and business. Spokane has revitalized their downtown, and most of the business owners are thankful we're there and open. But there are some who still believe if we would just close up, all these people would disappear. You're never going to beat all of that, but you can beat some of it.
I think that's what you're going to open the discussion with that, right? Patrick, is your economic analysis?
Well, yeah, we'll talk about that, Carol. But it sounds like Rob's got a line to some studies that we can reference. So I think that would be the most important piece I could summarize. Yeah, Rob, I think this is Patrick. I raised Patrick Jones from Eastern. I was the one to raise that point, because I think it's important to have a very candid discussion, during the summit about the issues that may arise, and hopefully allay some concerns.
Well, it's one of the biggest issues, but the reality is, if you do the math on how much it's costing you to have these folks homeless on the street, as opposed to what it'll cost you when they're housed or sheltered, you're talking about millions and millions of dollars saved. And that's really where the math comes in, and Providence and us have done a respite program here in Spokane for years that has saved a lot of money, not just for Providence, but for the whole downtown. It doesn't mean everyone's going to be warm and fuzzy and want you to build this thing, because a lot of people won't. But you can use math and data, because a lot of times people are like, oh, it's just another bleeding heart social worker, and it's all going to be a mess. And if you hit them with math and data and studies that show the benefit, the economic benefit of this, that usually belays some people.
Agreed. And Rob, I'll be talking to you real soon about that.
Happy to talk.
Okay.
I gotta jump off the call. Sorry about that, but it keeps kicking me off anyway. But I've got that date on my calendar, and happy to help any way I can.
Thanks, Rob. We'll keep you in the loop in terms of all the finalized details. Thanks for joining us.
Okay, take care.
So I think if we're all in agreement that we're brave are we still in the courage here to have this summit? Then we need to talk about the agenda and then review the list of possible attendees. And I think that, so for all of you that don't know, Patrick Jones facilitates the Greater Columbia ACH meetings, and he has agreed to facilitate this one and actually kind of start us off with some of that math and budgeting that Rob was talking about. Math and data, that's what he does best. And so we're going to rely on Patrick to show us, illuminate perhaps some of the cost savings that the community could experience and some of the benefits from doing this kind of a project. And then we also have, if we would like, Rhonda Huff has also volunteered to come down and talk about their experience with their respite care and some of their homeless housing.
I think that would be a great idea, that I've actually seen her do presentations at some of the annual wellness conferences, and the programs that they have, amazing. Like, I would love to be able to implement something like that.
Okay, all right. So, and then I was thinking that after that we could have Rob talk about, so what could it look like for the Tri-Cities community? And then I don't know that if there's anything else that we need to have on the agenda. I was just thinking of primarily those three things. Lona, can you think of anything else that should be addressed during that meeting?
So it might be
So this is Patrick. I do think it's going to be important, perhaps in the individual presentations, if not in a separate little presentation by somebody or somebody's, because the question will arise just like the question of the business community concerns. But how does this thing pencil out? So I think that's one thing that needs to be addressed throughout the summit. And then the other, if Rob's model is a correct one, or how can the Tri-Cities area community-based organizations participate in this, and do they have the bandwidth to do it? I think that's a big question, whether they could then sort of plug into the Spokane model, so to speak, or Catholic Charities model.
Okay, that's good.
I'd like to talk.
Carol?
Yes. I think Lona was going to say something, and then we'll let you guys talk on the phone. She's been trying to jump in, so go ahead, Lona.
one thing I think everybody ought to be cognizant of. We need to bring in the county commissioners. If it's going to be Franklin County, really concentrate on bringing them in the loop and getting the city officials, the planning department officials, every single department that's going to be touched if you're doing it in the past. So bring them into the planning process early. We're working on a 15 to 18 unit 100% homeless project, and we've started in December with a feasibility study with the city of Kennewick, and they were particularly supportive. And it was because we bring our projects and we really talk about them. We talk about them before we break ground, way before we go anywhere and get all our funding. Can this work? Right. What do you guys see? What do you see as the challenges? And that's been helpful. City of Kennewick helped us. We've just developed 60 units of housing, 50% of which was for the homeless. And that really, the partnerships with the city were key for us to move forward. And I think that's something that we need to really encourage them to be part of the summit and get engaged and involved and say how this can help you guys, because there won't be so many people in the streets, and connect it to dollars the city spending so they get behind it.
Yeah, it's a great idea.
I think it would encourage to have some of the heads of the police department and law enforcement able to test how to make their lives.
Speak up, please.
So Bessie was saying to bring in law enforcement, police, first responders, EMS.
Carol, this is Barb. I think it would also be helpful if you had the hospitals there, since you're going to talk with one of the savings would be a decreased ED use.
Yeah, so I have
We'll be
kind of
there.
a draft. I have a draft housing summit invitation list in front of us, and then Lauren just put it on the board. So if we're ready, we can address that. But were there any other issues on the agenda? Dan, did you want to talk about the agenda? Or
I just wanted to point out two things. One is a few of us have already been doing housing first model.
okay,
Like we've done a domestic violence housing first program for several years, and then you've been doing a housing first model. You may have too. So we've got some experience around it with different programs. So we bring in some experiential things. And one of the pieces that we found that made our successes enhanced them was the ability to have other flexible funding besides just to pay some rent. So you could do some other things that increased probability of longer term stability. So that was a piece.
okay.
And I'd like to get our name on it.
I thought it was. Brett and Franklin Domestic Violence Services.
Thank you. I'm sorry. It's late. I haven't
Kathy Jones is your contact for Pastoral Housing.
Okay, thank you. I was wondering who that was. So I think that we have a pretty good agenda. How long do you guys think that this meeting should be for? 2 hours? 1 hour?
Carol, let me ask you a question before you go to duration for this. So I heard what I'm hearing is this is invitation only. Select organizations and individuals will be invited. This is not going to be, I don't want to say open to the public, but I'm just saying it's going to be those that want to flesh out this idea before we get this to a broader group. Is that what you're envisioning when you say you have a list already?
Yeah, I was thinking that we could start with the yes people to get some community momentum around this, to get a little bit more organized before we would go public with it necessarily. That was just my idea.
Well, I'm fine with it. I just wanted to get clarification on it. And so you'll share the list with us. That may generate some additional thoughts of organizations to answer your other question about we have the right invitees.
So what do you guys think about that strategy, or do you think that we should just have the broad community discussion to begin with?
No, I'm not advocating for that. I just want to be clear and then make sure to go to your other question that we have the right organizations there. So if you send that out, that'd be helpful.
All right. So you probably are probably not sitting in front of a screen, Mark, but we have an initial list that I gathered from the continuum of care folk and some of the other organizations. So what is ANSEL stand for, you guys? The first one, ANSEL. A New Start in Life. The Benton County Jail. Benton County Veterans Group. That's not yours. I think you guys are Blue Mountain, right?
Talking about the county relief fund is on the line or file.
Yeah.
I'm sorry, I couldn't hear what was said. Yeah, I didn't hear what was said there.
So we're wondering, who was that guy that was at the continuum of care? His name was John Adams, and he was with the Veterans Group.
Oh, he's out of he's with the VA.
Right.
I can get you his contact information.
Well, I mean, that's the question. Is there a need to include veterans? Betsy's shaking her head no.
Well, I think there's the county level. That was county relief fund, and that one have like Sheila. You have veteran service officers.
Right.
They're more community and this county area. We serve Benton Franklin County. Is a much larger.
Okay. All right.
They have a grant program that they just started here, which they've had elsewhere for many, many years. And they do that adapt. So I would think maybe it would be somebody
Okay, all right. So we have a list here. I was just wondering who you guys thought should be invited, and I agree that we should invite the county commissioners. We also included the Department of Corrections and the juvenile justice system, the housing authorities, the hospitals, boards, trios, Cadillac, but some of the planning commissioners, crisis response, that would be Lord. Are there any big holes in this list, so we can get a really good list and be able to send this out really soon?
I think you need the business community, Carol.
Yeah?
This is Patrick.
Well, I think the Franklin Community Health Alliance is on there.
I don't think that counts. This is Kirk. I've been chewing on a question this afternoon that I think we need to keep in mind, which is that our two counties lie right on the diocesan boundary between Yakima Diocese and Spokane Diocese, and we need to be deliberate about not leaving on the table the idea that this is a Franklin County Pasco response to a Tri-Cities regional issue because of the connection with the Spokane Diocese. And I would be real deliberate about trying to find business leaders who are vocal and influential, not necessarily the president of the chamber, but who are influential.
Did you have anybody in mind besides the chamber?
I'm not even sure that the chamber was on my mind. I will do a little more thinking about that, but people like Dennis Poland come to mind, who has a business right kind of in the an area of Kennewick that is prone to this issue. But let me think some more about that, and I'll make some suggestions.
Bob, would you want Brian Ketchum to be involved since the Benton County side of the house is in that diocese?
Yeah, I think Rob left.
Marshall was on now.
It's just that every time we brought up this project, it was Rob's name that kept coming up. So, and I think it's because Providence has a relationship with the Catholic Diocese in Spokane. Not that Yakima wouldn't be a great advocate as well.
I was just thinking, just as a courtesy, so that he knew what was happening, and they are developing in Prosser. They have got a multi-phase project.
Okay.
That he might have some really good insights in working in Benton County.
No, I think that
would be good to bring to the table.
Okay.
And it would also kind of solidify the community, even though
no, I think that's a
separate family catchment areas. I don't want to leave Brian out because he's a great partner, and they have to
get together with you to get contact information. Okay, so I think if you guys could take a look at this list, and if there's any major holes that you see that are missing, I think the Yakima Diocese is really an important partner in all this. I agree that we need to have some business leaders supporting this project. County commissioners, city planners. I did invite Jeff Adams to this meeting today. He said he was going to come, so I was surprised that he didn't show up. But he's from Pasco, as you guys know. Now, what about, does Richland have a housing authority, or is it combined with Kennewick? Okay.
It went out of business in 2009.
Yeah, okay.
Anybody from United Way?
That would be a good idea. And I included the Tri-City Union Gospel Mission. specifically reached out to Andrew, but I could.
And I think that's going to be a key piece.
Okay.
I believe it was also brought up the importance of having that a shelter that is shelter, but you know that it doesn't matter for that sort of thing, and we don't have that around here. And we find that with our programs that there's a disconnect between what some of our federal funding wants us to focus on. Document chronic homeless, for example. They want you to have third-party verification. So that's difficult to do when we have limited outreach, homeless outreach in our area. And we can't, the harder to serve, the ones that we want as our priority are not ones that we can call the mission and say, hey, did they stay there with you? Because they're not even allowed to stay there. And so it makes it difficult for us to meet our requirements for the program for even enrolling chronically homeless. And my understanding is that that would use the same chronic homeless definition for these apartments that we use for our permanent supportive housing. So those are difficulties that we ran into.
So maybe you guys can explain to those of us that are not in housing, and I shouldn't even be doing this because I really don't know that much about housing, but the shelter versus housing. So why is this shelter an essential component of also the housing program? Is it that they go into a shelter first and then they get?
Our main goal was to have that rapid response for becoming homeless, or having there's a shelter that them, and then you're quickly moving them into permanent housing.
Okay.
And so that's kind of like where you find everybody. Yeah, the transition, okay, work with people even there to get them ready for you. Yeah, because there's so many rural areas. It's like you can get out the street.
But would we be asking Andrew Porter to open up some of his Union Gospel mission for more of the?
I think we could ask, but I don't know.
Yeah.
I know that they've operated that way for quite some time.
Right.
And that's yeah, there's a place for that.
Right.
And everything. I just think that with some of the strategies locally, statewide, federally, that it doesn't necessarily align with what we should be.
Right.
And air quotes should be doing. Okay, so I do want to sound like yes, and that's going to be very difficult without those kind of restrictions. We tried opening just a family with children shelter, and we had huge, resistance from the community. It was an awful experience. I feel like I'm still traumatized, but
And we had no NIMBY at the way of resistance at all. And we have a house in Richland that we have terrible NIMBY, just a duplex. And we have terrible NIMBY in that neighborhood, so location is key.
yeah. And I think like when Mona mentioned bringing in the commissioners, and I think it's right you're bringing in the planning committee, because those are people who make those decisions.
Right.
So when they have the opposition coming to the table saying, we don't want this, we want to make sure that they truly understand the reasoning why we're doing it.
We'll have to have really good data and really good math, Patrick.
Okay, well, I'll have a conversation with you offline. I think it's unrealistic to expect any really good local data, but I'm praying that we can do a really good literature summary from what Rob is saying.
Okay.
So would it be useful to have a representative business leader to speak as testimonial to the benefit of this from downtown Spokane? Just briefly, Patrick?
So
Wes, I can't hear you if you're talking to me.
So we were wondering if this would be a good meeting to have a local business leader come down and talk about the benefits to Spokane from the housing that's been built in Spokane.
Yeah, I'm just not dialed into that downtown community like I used to. I could ask and see if there are some supporters. Yeah, I could might be a possibility, but I do think Rob is definitely on the hot seat these days with the businesses that are around both the shelter and this new, actually very beautiful housing that they've managed to construct. But the business community, such as it is there, it's not in the heart of downtown, of course, have been very vocal about some of the issues that are affecting their foot traffic.
Well, and it might be easier to get somebody from Yakima if we can use Rhonda's contacts in Yakima. There might be somebody willing to come from Yakima. I think that the most important thing that needs to happen is when it goes to a planning commission. That's when you're going to need all your big guns out there supporting this project. So for this first meeting, I think it's making sure that we have all the right people that are interested in supportive housing for our Tri-Cities community. And this shouldn't be the only project that we build. I mean, Lona, you had talked about a project possibly in Kennewick. So I think that this problem exists throughout the Tri-Cities area. It's just that this was the connection that we happened to have, what was in Pasco. And that's kind of why we stepped out to pursue the Catholic diocese, quite honestly. And it sounds like they're readier to go. They've got the market study done. They're interested in this area, and they happen to have a piece of land that we could use. So all of those things, it sounds like the stars are lining up. But I think that we have to show the community that there's a true need, and that there are agencies and people behind this kind of idea. So it sounds to me like I need to meet with Andrew Porter.
I kind of also think that we ought to have a discussion a little bit around 50 units. Is that too much for an area? Because we were thinking more, as we're doing what we're doing, which is a little different, is that maybe 50 units in one place might be too much for a community. And I don't know about that discussion. That might be a good discussion to have, because what we're looking at is doing something that could be replicated on like an acre of ground that was just like an infill lot or something that it doesn't impact as much. And probably you're not going to get maybe as much NIMBY. Maybe you are. I don't know. You guys got NIMBY.
But
I think that might be a good discussion to have with community leaders. What is eligible?
Okay.
And I think that if you start small and you show that it works, that it opens up the opportunity to do more, and that you probably have less resistance on 15 units versus 50 units until you can demonstrate the effectiveness of it. And I know you can bring in data from other places.
Right.
But I think you're still going to have people that'll want to see, they won't leave until they see it.
Yeah, I didn't know if it was a kind of a scale of the project, that's what you build because it has found it as a long range. I didn't know, Lona, why he came up with that particular figure. Maybe that's what they've found in practice that is the best value. I don't know.
It's on the land, because the land we have targeted, what we're building is what the zoning will without a change in zoning.
Yeah, I think the other thing though to consider with that is when you start talking about all the additional services that they pull into that building, it becomes less cost effective, if you will, at 15 versus 50.
Yeah, I see what you mean. Yeah. Okay. Yeah.
Carol, this is Barb.
We need a cadre of retired nuns with cookies.
And Sister Esther is retiring, by the way.
Oh, perfect! It'd be awesome.
No, she's leaving the Tri-Cities. Sorry.
Oh,
but I have a couple things that I wanted to talk about just very briefly. I think that this is such a huge. When you think about homelessness, there's, you know, like so many pieces that go into that. I think for this summit, we have to remain, or we could be more successful if we remain very focused. Are we talking about, for example, homelessness for anyone, or are we talking about permanent supportive housing for the dual diagnosed patient that's chronically mentally ill? Do you see what I mean? So I think unless we get really focused on what our goal is and what the population is that we want to be involved with, we're going to get lost because it's way too big. It's an elephant. So anyway,
yeah, I think that's a good point, Barb. And again, you know, my 2 cents. I think you know, again, I keep going back to the hot spotters, and we've got individuals in you know, again, I think that super user is, you know, I think probably everyone would agree that's the really difficult person. I mean, you know, again, we don't have enough units just for everyone. But when you talk about trying to sell this as this is going to save ER services, first responder calls, you know, all of that, I think it's an easier sell when you're talking about those super users that really tax a system.
Right, and that fits with the models that we've learned from the ACH about, you know, the social determinants of health, right? Anyway,
right.
So that's my 2 bits about focusing. And Carol, I'll send you the names of a couple more people I think we could invite. And the other thing I wanted to mention is when Patrick talks about penciling out the bottom line for the structure, I think it would be very important if he could also pencil out a bottom line around what kinds of behavioral health services that Frontier or XYZ organization in Spokane provides to this population, because to me, it's like these are people in our PAC team, or like Kyle said, in hotspotters. So I just think these people are going to need a tremendous amount of behavioral health support, right? So what does that mean for the behavioral health providers in the community? You know, does this mean free care, or are they going to get any reimbursement for this? Anyway, that's, I think, important to identify.
Okay.
You know, from some of the data looked at, most of these individuals tend to be Caucasian. So I'm assuming that they're also low income, so they should qualify for Medicaid.
Right,
If there's a undocumented individual, that might be different, and we'll have to coordinate with the programs. For the most part, they should be at least able to receive Medicaid funding.
Right, and that's what I think too. But I just don't know enough about the new MCO contracts to be able to say this is what the MCO will reimburse for. You know, I don't know how much they reimburse for case management. It sounds like I would assume these patients need a tremendous amount of case management and medication management services. But I just don't know how the MCOs are reimbursing the organizations for those services now.
I just added them to the list. Thank you. I forgot.
Okay,
Barbara,
great.
Barbara, this is Sam. Each one of the MCOs has their own contracted rate with each entity.
Yeah, right. Right. So some things are better left unsaid. So.
Exactly. What else? We are at time. Unless you guys have anything else, any other contact?
Yeah, about the numbers is that do we actually have, you know, in the first summit, what we're wanting is buy-in to the program. And I think if we're realistic about it, we have to really assess what program we're looking at developing. If I heard right in the beginning, they were talking about dependency on other service agencies' availability to plug people in to work there 24/7 to oversee the needs. And so the number that you consider would depend on the buy-in and who's available at what, you know, can you
have a gap there, which is going to put your program at risk of failure because you're not going to have that support network in there 24/7.
Yeah, I think that's really important.
Fair.
Yeah.
You want to start with the program, and when you have buy-in, say, okay, now this is who we have to buy in. What can we provide that's going to make this a secure long-term?
Right. And I think that Patrick had suggested asking Rob to give us a bottom line. You know, what are the services absolutely that you have to have in order to make this successful? You know, and then we also need to know the number of units. That is the bottom line to make this thing work too. So we've got some bottom line numbers that we've got to figure out, I guess. But I do agree that we have to focus in on the chronically ill, the high risk super utilizers. I think that that's the population that we have the least amount of supportive housing for, because we're not going to be able to boil the ocean. Maybe we can boil the sea. I don't know. The Columbia River. Does anybody else have anything? I think the next thing we'll do is that we'll send out the invitation list one more time to you guys to confirm that we've got the right names. We'll include the commissioners and the folks that we mentioned today, and then we'll go ahead and try to send out the invitation next week so people can get this on their calendar, because March 19th is coming up pretty soon. So Rhonda confirmed that she could be here. Rob confirmed that he can be here. We've got Patrick facilitating. Hopefully you guys have put it on your calendar. We were thinking about from like 10 to 12 or 11 to 1 or maybe a couple of hours, because I think an hour is probably not going to be enough time for the discussion. So maybe 10 to 12.
Carol, the only thing I can add to that is if you're talking the 19th, at least for Benton and Franklin County, their commission meetings start at 9, so you wouldn't get a commissioner to attend. That won't happen. If it's going to be on a Tuesday, it would have to be in the afternoon for either Benton or Franklin County commissioners to attend.
Okay, so it would have to be the afternoon.
I just thought I'd throw that out there.
Well, that's very important, because we've got Rob for the 19th, but we'd have to confirm his availability for the afternoon. So what time are they done, Kyle?
That really varies. It would that varies. Sometimes a long time. Sometimes by noon. Not very frequently, but occasionally.
Okay. Well, we'll have to work a little bit, I think, on the time then for the meeting, but we do have Rob McCann for the 19th, so we'll have to kind of work around his schedule since he's.
Oh, you bet. You bet.
So, okay. Thanks everybody for calling in and being here.
Thank you.
Thank you. Bye.
Okay. Bye-bye.
Thanks, everybody. Bye.